Hello, everyone. Welcome to Gift of Health Weekly Wellness Chat. I am Dr. Rayapudi, and this is my lovely wife, Dr. Shobha Rayapudi. We are both co-hosts at Gift of Health, and we welcome you to our weekly Gift of Health Wellness Chat. At Gift of Health, we are showing people how to basically get off medications, lose weight, and reverse chronic disease by using simple yet powerful food and lifestyle habits. And every week, we are bringing you experts from various fields of lifestyle medicine. And today, we have a very special guest, Dr. Simran Malhotra.
And she is special. and we're so excited to have her. And like you might be wondering, like she's not only 1, 2, 3, but she's triple board certified. She is director of palliative care in Baltimore, from Medstar Harbor Hospital. And I know like she has many accolades, but like if you're wondering, like she is both certified in internal medicine, hospice and palliative care, and also lifestyle medicine. And that's where we got to know her as well. And but the most inspiring thing about her is like what she went personally. I mean, she is a mother of 2 and also a BRCA1 previvor with a strong family history of breast cancer. So she underwent risk reducing bilateral mastectomy and total hysterectomy. So like I thought there's no one who can best, I mean, talk about breast cancer, share her experience, and like educate us, because this affects so many women. So like and we are so excited to have her. So welcome, Simran.
Welcome, Simran.
Thank you. Thank you so much for inviting me to share my story with your audience, and especially to chat about breast cancer during Breast Cancer Awareness Month. It's, I mean, it matters every day of the year, but especially this month, it's important to talk about, spread awareness, show people how to take action to reduce their risk. So I'm super excited to be here. So today I was thinking I would share a little bit about my story, and then that'll kind of give you a glimpse into my personal story, but also my professional life, and then also how I got to lifestyle medicine and how it changed my life. So my story starts about 7 years ago. I was 26 and I found out I carried a genetic mutation, like Shobhadi just said. It's called BRCA1. For those of you that are not familiar, the BRCA gene is one that we all have. It actually protects us from getting cancer. It's a tumor suppressor gene. And so when cells get mutated or are dividing inappropriately, it destroys those cells, and so it protects us from cancer. So people like me who have a genetic mutation in that gene don't have the ability to do that. So when the cells start dividing rapidly, sometimes that can lead to cancer, and usually it's much earlier in life. So I found out I carried this genetic mutation. The BRCA1 mutation increases someone's lifetime risk by up to 87% of breast cancer and up to 40 to 50% of ovarian cancer, among other cancers as well. So my mom is my personal superhero. She's a 2-time breast cancer survivor. She was first diagnosed at 33, and then I was at the time 13 years old, and then again at 49. We lost her older sister, my Masi, in her 50s to a cancer known as primary peritoneal cancer, which is an aggressive form of ovarian cancer. And the youngest woman in my mom's side of the family was in her 30s when she was diagnosed, in her early 30s when she was diagnosed with ovarian cancer. So today, my mom is one of 9 women on her side of the family that have had either breast or ovarian cancer. So a very, very strong family history. Only 2 of us know we have a genetic mutation because either a lot of people have not yet chosen to get tested, but I know that one of my masis and one of my cousins is negative, and that makes me very, very happy. So the year I found out about my mutation, I was doing specialty training in hospice and palliative care. And for your audience that doesn't know, Palliative care is a field of medicine where we take care of seriously ill people with life-threatening diagnoses. I help with symptom management, goals of care, and just to provide extra support. If they get to a point where medical treatment is no longer being offered, that's when we shift to more of a hospice care philosophy, which is more end-of-life care. So I remember back when I started my fellowship, my very first rotation was hospice care. And one of the very first patients I met was a young mother in her 40s, and she just happened to have the same genetic mutation as me. She had lost her mom and her grandmother to breast cancer. And when she learned that, her and her sister decided that they were going to be proactive. They were going to get a preventative surgery, risk-reducing surgery. So they both scheduled their surgeries on the same day at the same hospital, and they woke up from surgery at the same time. And the surgery they had was a total hysterectomy. So they removed their uterus and their ovaries to reduce their risk of ovarian cancer. Unfortunately for my patient, she woke up and she was found to have advanced ovarian cancer. The one thing about ovarian cancer is it's a silent killer. We often don't find out about it until it's too late. And so for her, she was still about stage 3, and with aggressive treatment, she was able to live another 5 years. And I can tell you, based on my time I spent with her and her family, she lived most of her life in those 5 years because she knew time may be short. And during the last several weeks of her life, I remember she's one of my nearest and dearest patients. She had the worst abdominal symptoms that I've probably seen in any of my patients from the ovarian cancer. It had spread everywhere. So she had nausea, vomiting, abdominal pain, constipation. It was really horrible to watch. She was on a lot of medications. And a few days before she died, she found out that she had the same genetic mutation that I do. Her sister told her. And she was such a special soul because even though she was suffering, she had so many symptoms, but she continued to remain curious and attentive and just conversive. And one day I sat next to her and she held my hand and she literally looked me in my eyes. And she said, "Simran, don't let this happen to you. Do whatever you need to do to live a full life and be there for your future children." And I seriously can't say that or think about that without getting goosebumps everywhere. Those were the words that she shared with me. And on one of the last days that I took care of her, she passed away. After that, I ended up going to meet with a group of medical providers, genetic counselors, oncologists, doctors, and they all basically pointed me in one direction. And that was, you need to get these preventative surgeries. You need a mastectomy, you need a hysterectomy. Your mom was 33, you need to get childbearing done and you need to, get to surgery. So I was 26 years old at the time, right? Still in medical training. This was so much to absorb. I had 5 really big things I had to think about now, right? I had to finish my fellowship. I was about to get married. I needed to get pregnant, hopefully easily. And then I needed to have children. And then I needed to be sure I was done having children. And then I needed to get these surgeries, right? So thinking about all of that at the time sent me through these spirals of fear and anxiety and grief and tears. And, again, my mom was far away. She was in Canada. So my husband supported me so much, but it was a really, really tough time. Sorry, I get emotional even thinking about it. But it was hard, not because I was going through all that, but it was hard because I was a palliative care doctor and I was working at a hospital with a big cancer center, and I was taking care of a lot of really young women with cancer. And so that patient wasn't my first. Over the last several years, I've taken care of many young patients with cancer, some with mutations, some without, but many of them have died. And I've seen them leave their children, at the bedside. And that is probably what made it the hardest to see that happen, to see those people lose their lives at such a young age, and always wishing, was there something that could have been done to save them so that their kids, wouldn't be left without a mom. And so going back to kind of my story at the time, about 1.5 years later, I was now a full-time working doctor mom. I had a baby. I was breastfeeding, I was pumping at work, I was not sleeping, I was doing whatever I could to survive. And when my baby was 9 months old, because the oncologist said I needed to do this quickly, my baby was 9 months old, I got pregnant again. And so I was still breastfeeding my 9-month-old when I got pregnant again. And so I literally had zero time. I had zero time and zero concept of what you call self-care, right? Especially with all our family in Canada. So despite all of the craziness of those days, there was always this voice in the back of my head of my patient. And she was always saying, like, you need to do something, like you need to take action, because every day you're living, you have this high risk. You're getting closer to 33. What are you doing to decrease your risk? And every time I went to my doctors, because during this time I was doing screening MRIs, and then they would find these spots, and then I would have to get biopsies. And it was so much to just deal with that, like, every time I would ask them, like, what else can I do to decrease my risk? They never had anything to share with me except you need to have surgery. And for me, that was never enough, because it was like that primary, biological need of all of ours for autonomy was not being met. Like, I wanted control over my life, right? So what is it that I can do to control my life? And I never got that answer from my medical team, even though they were wonderful at what they did, but they never gave me that answer. And one night, breastfeeding, middle of the night, late night Google search, I find this guy, Dr. Michael Greger. And I'm sure you guys know him, right? And what I learned from him, and I hope I can meet him one day to tell him, but what I learned from him was not only mind-blowing, but it changed my whole life. Like, it changed the trajectory of my life. And in his book, How Not to Die, I bought it the next day. And the very first chapter, he talks about his grandmother's story. And I'll share it if that's okay. So his grandmother was 65 and she was diagnosed, she had heart disease. She basically ended up getting end-stage heart disease, which as a hospice physician, I'm very familiar with. She was recommended to go home with hospice. There was nothing more medical doctors could do. And that basically means either she was no longer strong enough for treatment, or there literally were no further medical treatments to be offered to her. Well, she must have been a really strong lady, because that was a fate that she just didn't want to accept. And I think she went to California, and maybe it was like a Pritikin program, but she basically joined like an intensive lifestyle program. She ended up reversing her heart disease. And I sometimes have to say that multiple times because I'm a hospice doctor. She was sent home on hospice, and she reversed her end-stage heart disease that her doctors told her there was nothing more they could do. And she ended up living another 30 years, okay? She died in her 90s. So to me, I was like, okay, what, like, this must be the miracle case that we see once in a while. Like, this can't be real, right? So then I started doing more research, and I come across Dr. Dean Ornish, and I'm like, okay, so he did studies in the 1990s on people with heart disease and showed that lifestyle could reverse heart disease. And I just recently graduated from medical school and residency. I never heard about any of this science. Like, where, like, so almost as a palliative care doctor, I almost felt like sometimes I cheat my patients. Like, I almost don't have that satisfaction for my profession anymore that I once used to have, because I sometimes feel like there is more that we can do, right? Unfortunately, the way palliative care works today is most of the patients I see in the hospital are usually within hours to days to weeks of dying. So they're very much at the end of life. So even at that point, if I brought it up, there's not a whole lot that I think we could do, but there's so much that we could do if we, talk about this way before, even at the time of the diagnosis of a serious illness. So to me, this was crazy, because as a palliative care physician and now as a family member, I've witnessed up close and personal and intimately what these chronic illnesses can take away from not only the person, but also their family, right? I've seen crippling symptoms of pain and anxiety and social isolation and debility and suffering and loss of independence and control, and then death. And so if there's something out there that, like lifestyle medicine, that could have maybe bought these people more quality and more time, then to me, it was like, why aren't we telling people about this, right? The possibilities that it carries. So to me, lifestyle medicine, that was when it came into my life, and not through my education, not through my training, but through a late night breastfeeding Google Google search for myself. Okay, so my genetic mutation literally changed, and Dr. Greger literally changed the trajectory of my life, and not only my life, but everybody that is in my circle. So I made these powerful, sorry.
No, I was saying Google can do wonders.
Yeah, right. Sometimes Dr. Google is not bad, right? Sometimes it can give us a clue in the right direction. So I made these crazy, powerful realizations in 2015. And, we were not, I grew up on, I'm Punjabi. I grew up on a very typical South Asian diet in Canada. My husband's French Canadian. He grew up on a very typical French Canadian American kind of meat and potatoes diet. So it wasn't possible for us to just overnight change our diet, but he was 100% vested in my health and anything that I could do to decrease my risk of cancer, because we wanted a family together and he wants me to be here for as long as I can. So the first step for us was we adopted a vegetarian diet in 2015. I've always been more strict than he has, but it's incredible what he's done as well for his life. And so we were vegetarian for a little while. And then in 2018, I was pregnant with my second baby and I picked up another book. And this time, this book was The Cheese Trap by Dr. Neil Barnard. Are you familiar with this book? So,
Yes.
so I'm 8 months pregnant and I'm still breastfeeding my first baby. And I'm on this chapter and I'm reading, and all of a sudden I just start crying. And I go and talk to my husband and he's like, "What's wrong?" And I, for the very first time in my life, and this was almost like, I think I was 29 at the time, for the very first time in my life, I made the link that, I was drinking the milk that the mother cow was making for the baby cow. Like, that was the very first time I made that link, which is crazy. And I couldn't stop crying because all I could think of was, I'm about to give birth to my baby, and like, imagine someone came and took him and then took my milk to give to someone else to drink. And to me, it was gut wrenching and it just broke my heart. And that day I did go vegan overnight because that aspect of it somehow meant so much more to me than, I guess, my health. I don't know, but it just touched me so deeply. Right. So we went vegan. I think the other learning point here, and because I'm a palliative care doctor, I like to talk about this, is that a lot of times, and I said this myself, I can't give up meat. I can't give up cheese, but I can give up meat. Or I can't give up meat, but what is it? I can give up
meat, but I can't give up cheese. Because this is something that you hear
all the time.
Yeah, because cheese is so hard to give up.
Yeah, and so I was so interested in like, why is that the case? So Dr. Barnard's book actually really intrigued my interest because he talks about how dairy cheese has something called casomorphins in it, and casomorphins are kind of derivatives. They have a similar structure to opioids, and I'm very familiar with opioids as a palliative care doctor because we use them a lot for pain management. And so just like the idea that like the reason people can't give up cheese is because they have an addictive component, it just made so much sense to me. So it was almost like I think I would have had to wean myself off of it, but I think because of that animal cruelty aspect, I was able to just kind of, cut it short. And just go vegan overnight. So that was just another mind-blowing like kind of connection I made from a book that I read at the time. But I think, the most beautiful part of it all, I think I mentioned earlier, is kind of the ripple effect that this has had on my husband and my mom and my mother-in-law and my friends and my children. I mean, we're raising them plant-based. They don't know anything different. And they're like growing so beautifully, and their doctor loves that she literally only sees them like once a year. And it's just been amazing to watch the weight loss, the blood pressure improvements, the cholesterol improvements, more energy, less anxiety. And these are all things that people weren't even trying to achieve. Like, they just made small changes in their diet and they noticed all these improvements. So for me, that was so fulfilling. And I'm sure you guys have kind of noticed the same thing, right, with your families?
Yes.
Yes. So,
Yeah.
so Simran, I know like there's so many parts to your story that is like really heart touching and makes us cry. Even now, like I was getting goosebumps when you were talking about, and a lot of people, I mean, a lot of our viewers today are also wondering, like when we get the diagnosis of cancer, like it's like a whirlwind, like as you said, like exactly like what you were going through with, and like what to do. So like what we have, one of the questions here asking is as you were describing about the genetic component and other components, so they were wondering like what causes breast cancer.
Yeah, I mean, that's a really good question. And there's not just one thing that causes breast cancer, or any cancer for that matter. Cancer is a very complex beast, if you will, but you have different risk factors for different cancers, and you have some risk factors that are non-modifiable, which means they're not really in your control. And then you have some risk factors which are modifiable, which means they are somewhat in your control and you can do things to reduce your risk. So we can talk about those. Would that be helpful? So the non-modifiable risk factors, I would say your top 3 non-modifiable risk factors. It's amazing to be female. I would never change it for the world, but the number 1 risk factor for breast cancer is being female, and that's something we can't change. Typically, for the average person, your risk will increase after the age of 50. And yes, it's most common in females, but men also get breast cancer. And it's not as common. It's about 1 out of every, I think, 100 diagnoses in the United States. I'm not sure about Canada, but it's not as common. But I think it's just important to keep in the back of our minds as well. The second kind of big non-modifiable risk factor is age. So the average, person, at least in the United States, and it's probably the similar in Canada, it's about 1 in 8 women will develop invasive breast cancer over the course of their lifetime. So a lot of people hear that 1 in 8 number, which is about 12%, and they think that risk applies to them today, but it's not today. It actually the risk increases as you get older. So that 12% is like in your 70s. So it's a lifetime risk. But this doesn't apply to people like me who have an inherited genetic mutation. So genetic mutations like the BRCA1 mutation can increase your breast cancer risk by up to 85, 87% lifetime risk. So it's much higher than the average person, and same with ovarian cancer. Not all genes are created equal though. We have like higher penetrance genes like the BRCA gene, and then you kind of have moderate and lower penetrance genes. So not all of them cause breast cancer like BRCA, but they are important because they do elevate your risk. So I think, so those are I guess I just touched on the third one. The third non-modifiable risk factor is a known inherited genetic mutation or a very strong family history. So there is kind of a hereditary component, and then there's like a familial component. So familial basically means that, there may be a low penetrance gene and environmental factors that contributed to the breast cancer risk. But then there's also the fact that, we're still very much learning about all the new genes, and they're discovering new genes all the time. So when my mom was first diagnosed at 33, they did genetic testing. Her genetic testing was negative at the time. And then when my aunt got diagnosed with ovarian cancer in 2014, I told her to get tested again. And then we found out the variant of the BRCA gene that she has. So the point is that if you have a very strong family history and somebody has tested negative, I think the recommendation is like every 5 years or so, you should repeat the genetic testing if it's appropriate. And the best thing to do is to get in touch with a genetic counselor who can guide you on kind of the latest recommendations. So those are kind of the 3 non-modifiable risk factors.
What would you say, like for our listeners' sake, Simran, what would you say the modifiable risk factors?
So this is the best part. I think the favorite quote that I like is from the CDC, and mostly, and not just for breast cancer, but almost all disease states. When you talk to most people, they will blame it on their family history. And that's true. We all know that as doctors, but when you talk specifically about breast cancer, according to the CDC, only about 5 to 10% of breast cancers are due to a hereditary mutation like the one I have. A small component is due to kind of that familial predisposition that I just talked about, but the large majority, above 80 to 85%, are sporadic mutations. And that means that most of those breast cancers are related to our environmental factors, our lifestyle factors. And actually, I heard a talk recently by Dr. Chrissy Funk, who's a breast surgeon in California. She's a lifestyle medicine doctor as well. And she said that 87% of women that come in don't have a single first degree relative with a history of breast cancer, which is pretty like mind blowing. But when you talk about the modifiable risk factors, at least the ones with the strongest evidence behind them, and I usually, my favorite resource for cancer prevention recommendations is the AICR, American Institute for Cancer Research. They're kind of in collaboration with the World Cancer Research Fund. So they have dedicated everything they have to looking at the links between cancer prevention and lifestyle. So their strongest recommendations when it comes to breast cancer are, with the strongest evidence, are obesity, alcohol, tobacco use, and exercise. So we can talk a little bit more about those in detail, or if there's other questions, we can talk about those, whatever you guys want to.
So before you go on to this, Simran, we wanted to tell, so we have lovely comments for you. So we have people from Ontario, Des Moines, Iowa, and they're all like, this is great info, thank you. So as you can see, like Simran is speaking about so much valuable information. So feel free to invite your friends, because this information is life-changing. So, and let us know where you are joining from. And as we said, like
yeah, Sean says hello. Sean is from Newfoundland. Connie is joining us from Jamaica. And
okay.
Marilyn Jane is from Ontario, and Paula is joining from Des Moines, Iowa. And Jacqueline, she's saying very informative, like, they're enjoying your story. And I personally felt like when you're sharing your story, it is so much to go through. And, one of the common thing I say to my patients are like, when I'm hearing their stories is I can only imagine in your situation, but in your story, I was thinking, I can't even imagine your situation. Like, it's like when you have so many things going on, like you're 26, you get this diagnosis, you're about to get married, you want to have kids, and like, you're still finishing your residency fellowship. It's so much to take on. Kudos to you, like how you handle it and how you are handling it. Like, we're so.
Thank you. No, I appreciate that. Actually, I would say the hardest part came after January of 2020, when I actually finally had to decide to schedule my surgeries. And then I scheduled my surgeries for June of 2020, and then COVID happened. And our entire life changed because my husband is an ICU doctor. So he moved out for like 12 weeks because there was so much uncertainty. We didn't know. And then I became a virtual telemedicine palliative care doctor, taking care of only seriously ill COVID patients at the end of life and doing virtual meetings. And then I finally ended up having my surgeries, like Shobhadi said, in September. I had the mastectomy, I had the hysterectomy, went into surgical menopause. And I was actually at the prime of my life. I thought I was in the best shape of my life. I was eating good, everything. I ended up having a major complication from surgery. I had a major bleeding complication and ended up going for emergency surgery the next morning. And that's probably what hit me the hardest, because I didn't even anticipate that was going to happen. And for the very first time in my life, I got a glimpse, like a tiny glimpse into the life of some of my patients who were dependent on family or other people for their care. So for several weeks after my surgery, I needed help to go to the bathroom. I needed my husband to give me a shower. There was this one day, and this is kind of where that turning point really came to adopt the rest of the pillars of lifestyle medicine for me. Is one night I was sitting in my recliner and I didn't have my phone and I couldn't get up, and my husband was downstairs with the kids and I really had to pee. Like I had to pee. I tried to get up, I couldn't, because I had an abdominal incision as well. So it was like I had drains. So it was a lot. So I was waiting for my husband to come up, and by the time he came up, it was dark, and he came, I was crying again. I cry a lot. I'm a very emotional person. So which is good. Emotions are good. They're meant to be let out, right? So, but he came and I was crying, and that was in my head, it was kind of like the big pivotal moment in my life, because it was like the first time I ever said like, okay, Simran, like as soon as these doctors clear you for exercise, like you are getting on that bike. There is no excuse. Like, you never want to be in this position again where you have to be dependent on someone else for your basic tasks, where you can't even get up to go pee. Like it was such a, like, again, getting goosebumps. It was such a call to action for me. Like it wasn't even about self-care for me anymore. It was like self-preservation. And so this past year has been the first year of my life where I have 2 little kids, but I wake up every morning at 5:30. I get on the bike. I meditate. I do everything to fill my cup so that the rest of my day I can give to my family, my patients, whoever needs it. But that was the big mind-blowing moment for me on this whole journey.
Yeah, very, very inspiring. Thanks for sharing that moment. It's so touching.
Yeah.
It's, your patients are very lucky, I must say, like you going through all this and like you're giving back. What the experiences that the life is teaching you, not only the medical side of it. You are specialized. You're a specialist in many fields medically, but coming from the heart, working through your experiences, your patients are very privileged to have you as a doctor.
Oh, thank you. It's been a tough field to be in for the last 18 months.
Yes, we can
starting
imagine
to really feel it.
palliative and hospice care, especially when you're doing this during this COVID time. It's and in the city of Baltimore, we can only imagine like how busy you are.
Yeah, I mean, lucky for me, in January of 2020, I was able to go part-time. Like our kids are 4.5 and 3, so it just was best for our family. So I think that's the only reason I'm still able to work, because otherwise, between my healing and my recovery and the emotional burden of the pandemic and COVID, and I don't know that I would necessarily be able to keep going. So I'm still going, and I'm grateful to be able to give back for sure.
Like as you said, Simran, like I can only imagine as doctors when it was so difficult for us to get this information. You said like one night you were Googling and chanced upon Dr. Greger. Like imagine if we had not found him, or like even legends like him in plant-based world. So when it is so difficult for doctors to find this kind of information, I can only imagine like what a common man can go through. So like our viewers are really lucky, like getting all this information from you, and also like,
and everything you guys are doing. That's amazing. This is the reason why we do these things, is so that we can continue to spread the word. And even if you're able to touch, this is the way I look at it when I share my story, and I'm specifically very interested in helping young women with genetic mutations at high risk for cancer. That's like my kind of target population that I love to talk to. And even if you can touch one person with your talk and that can change their life, then you've done what you were meant to do, right? So that's the way I look at it. And it's one person at a time, one step at a time.
Yes. And like we, as you were speaking, we had one question. So Paula is asking, was it hard for you to transition away from cheese and meat, even when it was the right thing to do?
It was hard. It was hard. No change comes easy. I'm going to be honest. No change comes easy. And I think for us, what made it easier is because it wasn't so much about the how are we going to do it, it's the why are we doing it. And I know you said we knew why we had to do it, but the why was so strong for me. Like we were about, we just had our children and everything, and I knew that I would do anything to be there for their future. And so for me, that was always at the back of my mind. In terms of the practical day-to-day, how did we do it? The first way that we did it was we made a list of all our favorite foods. And then one by one, we basically looked for a plant-based alternative for each one, from like pizza to, name it, anything. Like we literally made a whole list and we found our plant-based alternatives, and we didn't stop eating that food until we found our favorite like new alternatives. So, and again, that was a journey from 2015 to 2018. We had, lots of the plant-based alternatives, a lot of the transitional foods that you can call as you're transitioning to more of a whole food plant-based diet. But there's a lot of vegan alternatives. So we tried all of them as a transition. And then in 2018, when I read Dr. Neil Barnard's book, I kind of was ready. And so it was really easy to just break the tie.
Yeah, so people are thanking you. I like the idea of making the list of favorite foods. Does your husband miss poutine?
Yeah, Paula is asking, does your husband miss poutine, and what is the
I miss poutine sometimes, I'll be honest. I'm not gonna lie.
And and Paula is asking, what is the plant-based alternative for that?
Okay, so I'm gonna give you a secret insider tip. So there is a vegan chef in Quebec. His name is Jean-Philippe, and he is like the vegan king of French cuisine. And he has a great recipe for poutine. So we have vegan poutine, and there now are some, at least in the Baltimore area, there's some really fun restaurants. It's not healthy, but if he ever has a craving, he will go have vegan poutine. But you can basically make the gravy out of mushrooms, and you can make the cheese curds out of tofu. And it's really, really, really good.
That sounds good, Simran. Like we have a fantastic recipe, and the Gift of Health community, they love it. So what happened
really?
is, like one day we gave a presentation to local group that we have a TOPS group. This TOPS is it's like a small group where TOP stands for taking off pounds easily. So that's sensibly. So they invited us to give us a talk. So, okay, we said like, why don't we do a potluck? So there were over 25 women, and they made different things. And we actually took one of the favorite recipes that every Gift of Health family member likes. It's the cheese sauce, like the cheese sauce made with, we have it on the Gift of Health website. It's made with cashews, carrots,
onion,
potatoes, garlic powder, onion powder, and salt. And it's so tasty, so creamy, so cheesy. And we made like a fresh fries in the French fries in our air fryer. So we had this freshly made fries, and we poured this cheese sauce. Like we like to eat that way, and we served it to them. And almost everyone said that like it tastes like poutine.
Yeah.
So it's you go to Gift of Health site, Paula, just get the recipe for the cheese sauce and the fries, the French fries made in the air fryer or in the oven. You make that, and like you won't be disappointed.
Yeah, I think that's been the most like enriching part of this whole experience of transitioning to a plant-based diet, is that like if you make food that tastes good, people don't really care what they're eating. Like it's really about the taste, right? We were just in Quebec for Thanksgiving, and most of my husband's family is not vegan, but me and his niece cooked a whole plant-based Thanksgiving, and everyone loved it. So we made baked mac and cheese, we made a vegan Wellington, we made all sorts of fun stuff. And like everyone was like, this is vegan? It's like, yeah, it's vegan. So
yeah, that's
yeah.
see, that's a very important mantra we share as well with our students. Like, if especially when you're trying to serve to the picky eaters, children and the adult children, like there are a lot of adult children, like so the picky spouses and the other family members. If the food is tasty, who's gonna say no to it? So
Right.
yeah, and like it's a good that one of the sustainable way to start transition is to start with the foods that you love, as you shared, like the making the list of favorite foods. The start with the foods that you love, and you can create a healthy plant-based version of every food, like fries, chips, popcorn, cheese, cakes, cookies, and you ice creams. Practically, we don't miss anything. Like,
No.
yeah.
And I think, 10, 15 years ago, it would have been much harder, but we're living in the easiest time to transition to a plant-based diet because there's more awareness now. So more companies are developing products, and some of these vegan cheeses, it like mind blowing. There was a Quebec company. Actually it's an Ontario company. It's called Nuts for Cheese, and they make a blue cheese. Oh my God, it tasted like real blue cheese. It was like mind blowing. So there's so many options now, right? And not to say that all of these things are healthy. The studies have shown that people that follow a vegan junk food diet, right, like ketchup and fries and Oreos and chips, they actually have worse outcomes than people that eat the standard American diet. So I'm not saying all of this to say you should eat vegan junk food, but if you're somebody that is trying to incorporate more whole food, plant-based foods into your diet, sometimes those transition foods can be a good stepping stone to getting to whole foods.
Absolutely. Like you just hit the nail on the head, Simran. Like earlier, like you were talking about the modifiable risk factors, and now like you spoke about the food, and it may not be hard to change now, like given like when compared to previous years, as you said. So like, can you touch base on like what are the modifiable risk factors that our viewers can take away from this?
Yeah. So let's talk about food first. So there are, again, I was talking about AICR earlier, and the AICR gives kind of like the strongest recommendations from their huge systematic reviews. And so, when it comes to specific foods, they kind of categorize it all into limited evidence. But I think the one risk factor that, no one can deny that, increases a woman's risk of breast cancer is obesity. And so how food plays into that is that the standard American diet, and probably very similar in Canada, is calorically rich, but nutritionally deplete. It's high in fat, high in refined sugars, and high in all of these things that lead to weight gain. And so indirectly, that weight gain and obesity increases your risk for breast cancer. And so women that are obese carry a 1 to 2-fold increased risk of breast cancer, and their risk of dying from breast cancer goes up by 30%. So that is a huge risk factor that can simply be modified just watching, the food you put on your plate and, what you put on your fork to your mouth. And all of the major kind of cancer societies, including, like I said, AICR, the American Cancer Society, and even the CDC, they all now recommend that when it comes to cancer risk, not just breast cancer, cancer risk in general, they're recommending that you want to focus predominantly on whole plant-based foods or have a plant-forward diet when it comes to reducing your cancer risk. And the reason is because, the food we eat, it can affect estrogen levels. It can affect inflammation. It can affect free radicals, growth hormones, blood vessel formation. Like there's our immune system, and all of these things is going to create an environment in our body that's either going to, help the cancer thrive, or it's going to help our body kill the cancer. So you really want to make sure you're feeding your body the foods that are anti-cancer and full of kind of what we call phytonutrients. When it comes to kind of breast cancer superfoods, again, the book I love to recommend is How Not to Die. He has a whole chapter on breast cancer, but kind of, again, whole grains, fruits, vegetables, you've heard that a million times, but soy, we can talk a little bit about soy. Vegetables in particular, cruciferous vegetables are where kind of most of the evidence is, because they contain a compound known as sulforaphane. And that has like 100 times kind of the anti-cancer property. And if another pro tip is something you can pick up at the grocery store, or broccoli sprouts, they have like way more sulforaphane than regular broccoli and bok choy and all of the other cruciferous vegetables. So mushrooms, berries, flax seeds, turmeric, green tea. These are all the things you can read about in Dr. Greger's book, or Dr. Funk also has a book, which I love to talk about, is called Breast, the Owner's Manual. That one really helps me as well. So they talk about all these foods. But the take home point here for food is that it's all about, it all comes down to fiber. So dietary fiber, the studies have shown that women that take in about 30 grams on minimum, 30 to 40 grams of fiber a day can drop their breast cancer risk by up to 40%. And this is really important because the average American, and I don't know, this is probably similar in Canada, but the average American takes about 10 to 15 grams of fiber a day. So at the end of the day, like that is kind of, everyone's worried about protein, but really everyone should be worried about fiber, because that's really what's going to reduce our risk of cancer. And all the other major top killers, actually.
Yes, that is so on the point, Simran. So if people are wondering what cruciferous vegetables are, so like cauliflower, broccoli, and as Simran mentioned, even like broccoli sprouts, they're all excellent sources of anti-cancerous. And also like when it comes to leafy greens, kale, so like all these are good for you and provide a lot of protection from cancer.
One thing I think it would be a good time to also talk about the confusion about the soy and the minimum, especially the minimally processed soy, because soy gets so much bad rep, right?
Yeah, no, soy is like the biggest controversy that exists, I think, when it comes to breast cancer and food. And I think before we even talk about the studies, I think the way Dr. Chrissy Funk explained it has stuck in my head, and it makes so much sense. So maybe explaining it first would make sense. So soy has something called phytoestrogens. Phytoestrogens, specifically the ones that are rich in soy, are isoflavones. And so they are like estrogen, but they are not the same thing as human estrogen, okay? And what's important to know is that in our bodies, our cells have two types of receptors. You have alpha receptors and you have beta receptors. And human estrogen mostly binds to alpha receptors. And this is also true for the breast cancer cells. Whereas soy phytoestrogens, or those isoflavones, they bind to the beta receptor by like 1,000% more affinity for those particular receptors. And so when the phytoestrogens or the isoflavones bind to that beta receptor, what it actually does is it kind of tricks the alpha receptor. It shuts it down or it turns it off. And so at the same time, it also sends signals to our fat cells, which have enzymes that produce estrogen, to shut that off. So really, they have a very weak estrogenic effect. And you can also say they have an anti-estrogenic effect, because most of the human estrogen binds to the alpha cell and alpha receptor, and soy shuts that down. So it works like the drug, if anyone's ever heard of it, it works like tamoxifen, which is a selective estrogen receptor blocker. And a lot of women who have hormone receptor positive cancers are given tamoxifen. Yeah. So phytoestrogens have actually a protective effect.
Like on the same note, Simran, I loved how you explained this isoflavones and a concept of phytoestrogens. So on a similar note, like I love the analogy how Dr. Barnard mentions about this too. So like I love the way he talks. So just like in your car, you have the gas pedal and the brake. So even in your body, so you have estrogen receptors which act like a brake and which act like a pedal. So all this, like the phytoestrogens from soy, are actually breaking the cancer cells. And so, and that causes, because that is a confusion for a lot of people. So it's a good thing. So what soy has is phytoestrogens, and it is acting like a brake.
Exactly. Yeah. So it's like more anti-estrogenic. And so I think the main point to remember is that a lot of the concerns of soy are based off of studies, in the 90s that were done on mice, right? And so since 2009 or so, we have now hundreds, if not thousands, of studies in humans that show the positive effect of soy, including the reduction of risk of breast cancer. So almost all of the studies, if you look at them together, show that women that consume higher amounts of soy, and it's not even that much in the studies, you're talking like 1 to 2 servings a week, were found to have like 30 to 60% less risk of breast cancer, or 30 to 60% less risk of recurrence, and overall decreased risk of mortality by like 30%. So, and these are like, again, they're not like clinical trials, but these are large observational population-based studies. Like one of the biggest studies was in the Shanghai, I pulled it up, the Shanghai Women's Health Study. It's like over 70,000 women. So these are very big studies. So it's good. And there was actually one published earlier this year, because the other big question about soy is that, is it an endocrine disruptor? And so one of the big meta-analyses that they did earlier this year looked at over 400 studies of soy in human consumption. And the question was, are the isoflavones in soy endocrine disruptors? And what they found is that it doesn't affect thyroid function. It doesn't affect estrogen levels. It doesn't affect ovulation. It doesn't affect semen levels. It doesn't, and from what they know, at least based off of the evidence they have, it doesn't affect children. In fact, the evidence that they do have right now says that children that consume soy before reproductive age actually have a lower risk of adult onset breast cancer. So it's pretty amazing.
Yes.
Yeah, it's, to basically, if you have to summarize in like, in 1 or 2 sentences, we can simply say soy products, the minimally processed soy products are protective. The confusion is only in the internet, but not in the science.
Yeah, well, that's the problem, is most people don't follow the science. So, which is true for many other things too. So, but when you talk, I think you pointed to an important thing. What is minimally processed soy, or what is whole food soy? So whole soybeans or baby soybeans, which are known as edamame. Tofu is minimally processed. Soy milk is minimally processed. Just make sure it's unsweetened. Tempeh. Those are all kind of minimally processed whole food sources of soy. So when it starts to get unhealthy is when you're eating more of the processed versions of soy. A lot of the fast food restaurants now, if you're getting deep fried food, it's being fried in soybean oil. Soybean oil is very bad. It's very pro-inflammatory. And then the other kind of key word is a lot of the mock meats and things have something called soy protein isolate. That is kind of a heavily processed version of soy.
Excellent. Yeah.
So
Robert is asking.
Before Robert, actually, while Simran was talking about fiber, Paula is asking, does taking Metamucil count as getting fiber?
I think you guys can answer that too.
Yeah, Paula, see, good try. It's not just Paula, like many of us, like we like to do the quick fix way, like, can I take this pill or can I take this supplement? But think of it this, Paula, like, Metamucil, when you take it from a bottle, you're just taking a spoon of this processed fiber. But if you're taking fiber from steel cut oats or rolled oats or like fruits and vegetables and beans and lentils, you're taking the fiber in its purest form, the way the nature packed it, with all the vitamins, the minerals, the phytochemicals, and the antioxidants. So taking a fiber from Metamucil, it may give you that number, like, oh, I'm taking enough number of grams of fiber, but you're missing out on all these other benefits that are happening with the natural fiber. There is actually research done on this, like well,
that's the studies. The studies that I mentioned earlier with the breast cancer risk reduction, they specifically looked at dietary fiber. So that's fiber that you get from whole foods.
Yes, excellent. Yeah. Robert is asking that one of his friends who's following keto diet was diagnosed with breast cancer. The cancer was an aggressive type but it did not progress as they would have expected. They told her the keto diet saved her life. Have you come across anything like this before?
So there is no evidence right now that the keto diet is good for cancer prevention or decreasing risk after someone has had cancer. My argument would be that the keto diet is very high in animal products, very high in saturated fat, and is very pro-inflammatory. So obviously this is one anecdotal case, but I think if they looked at this at a population level over many, many years, I think what they would probably find is the keto diet actually may be associated with an increased risk. Because that's what we know about the keto diet and all the other kind of major chronic illnesses is in the long term is actually when we get very worried about all the health risks.
Yeah. So actually, like I would say, like following keto diet when that person was diagnosed with breast cancer. Like if you look at keto diet, like when there is more fat, as you were describing the risks of obesity, so that itself is a risk factor for breast cancer. So actually, like going on this diet, it increases the risk of having breast cancer. And
I would like to add one thing. See, what happens is when people are on standard American diet or standard Newfoundland diet, standard Canadian diet, from that, if you go to a maybe more vegetable rich keto diet, like there are some people who do keto
Like
diet.
a plant-based keto diet.
I'm not a proponent of keto diet, but if you're instead of eating like chips and fries and salt beef and all the fried processed meats, if someone went to like eating more vegetables, more fruits, and some like dairy products and some meats, so their diet is actually getting healthier compared to what they were eating before.
Yeah.
Robert, are you with me on this? So someone who switched to keto diet, many people, when they go from standard Newfoundland diet to standard American diet to keto diet, in the initial phases, many people feel better.
Yeah.
But if those people stay on it a little longer, then you'll see these people get more gallstones, more constipation, more acid reflux, more kidney stones, more
heart disease.
So keto diet may help you lose weight in the short term, or like you may find some health benefits in the short term, but in the long term, like it is playing Russian roulette with your health.
There was only I have one coaching client who has glioblastoma, and there is some kind of inconclusive evidence around the keto diet and brain cancers. But even that, there isn't enough evidence to say, to recommend it. So the only place where the keto diet is like a therapeutic modality and is recommended is in, I think, childhood epilepsy. So yeah.
Good. You want to go with this?
Yeah. So we have other question from Colleen. Is the TVP, texture vegetable protein, a processed soy?
TVP is that
TVP? It's a textured vegetable protein. It's like
is that like seitan? Is that like seitan?
It is similar to it, but Colleen, like to answer your question, the textured vegetable protein, it is a form of processed soy. Is it the question is it heavily processed or is it mildly processed? I would put TVP in a moderately processed category. This is not something that I would recommend you have it every day, TVP. But I have seen like some of the Gift of Health family members and other people use this TVP to give more texture. So if you're using it every now and then in your dishes, it's fine. But one of the dishes that people use it is goulash. Goulash is a typical Newfoundland dish. For the texture, people use some TVP, but people have replaced it with, like, even if you use quinoa or crushed lentils, you can get similar feel and texture depending upon the spices you use. So it's better to lean towards the more whole foods than finding this processed alternatives. Like as Dr. Simran said, like if you're using it as a transitional thing for a short period of time, it's fine, but don't be stuck on these transition foods.
Yeah. And I think my philosophy is this, like I have kids and, they're growing up in America. And so, they're going to the birthday parties and they're doing all the things. So, I still allow them to have, vegan donuts and vegan cupcakes from time to time, but it's not what we're doing 90% of the time, right? So most of the studies, also when you look at the blue zones and things like that, which are the areas of the world where people are living the longest, it's kind of like an 80-20 ratio. So it's like, what are you doing 80 to 90% of the time? That's what's going to make the biggest impact on your quality of life in the long term, and also your health, your disease risk and all of that. And then, that 5, 10, 15%, that's kind of where I feel like the vegan alternatives and the fun foods come in when you're going to a party or if you have little kids. So.
Yes. We have a 17-year-old and he started eating plant-based when he was 8. And our situation was very similar to yours. Like, we could control what we feed at home. I mean, we don't bring anything into the house that that is not whole food plant-based, and everything Shobha makes is all whole food plant-based. But when he goes to birthday parties, when he's with his friends, like, if he wants to have cake or something like that, like we don't, restrict because the more we try to push it on the kids, it's the more they want to do it. Yeah, they want to do it. So, but as he's growing up, like he's 17, and we'd say his choices with a period of like he hasn't had meat in like in a long time. And even the processed plant foods that has gone down quite a bit, like over a period of time. So it's just, I mean, it's a process when it comes to kids. Yeah.
Yeah, I feel like when they're younger, because they have such an affinity, like they're born with a love for animals. So when they're younger, you can talk to them about kind of like from that standpoint. But as they get into the teenage phase, a lot of them are into athletics and sports and all that stuff. So coming at it from like, there's the documentary The Game Changers. Any of people that ask me about like how can I help my teenagers transition, I usually tell them to show them that movie, because it can kind of motivate them that look, all these other athletes are doing it, and it's good for your sports and your recovery.
Yes, it's an amazing documentary, The Game Changers, right?
Yeah.
Well, all our viewers are thanking you for joining us, Simran. Thank you so much for being with us and spending this valuable time. You could be doing so many things with your family, but you are with us and sharing your expertise, and not only expertise, sharing your experience. So thank you so much.
Oh, thank you for having me. I appreciate it.
Yeah, and as I said, this is life-changing, and like this session may change many lives. So thank you so much for being here, Simran.
Yeah. If anybody in particular is interested in about the genetic mutation piece, lifestyle, all of that, I share a lot of content on my Instagram. So people can follow me there. You can probably share it.
So we'll be sharing your Instagram page. And besides that, do you have anything else?
Any other resources people would?
The website is under development, and I'm starting my coaching stuff. So particularly, like I said, for those young women at high risk for cancer, helping them optimize their lifestyle. So that'll be coming in the next few months.
Wonderful.
Sure.
Yes.
And I'll share it when it's live with you guys.
Excellent.
Yes.
Wish you all the best. And thank you.
Yeah.
Thank you.
Thank you so much, Simran.